Hi, I'm Dr. Melissa Garrity, a clinical health psychologist and CEO of Phoenix Rising with Dr. G, and I'm honored to present today Coping with Medical Gaslighting on Your Path to a Spinal CSF Leak Diagnosis and Treatment. So, to get started, here's a little bit about me. I specialize in chronic pain, complex medical, and eating disorders. I'm an international workshop presenter and a person with a lot of different physical disabilities, such as the rare disease tethered cord syndrome. When I had neurosurgery in October 2019, I ended up getting a spinal CSF leak and had to have an internal repair. So you can see this picture on here is right after my neurosurgery for tethered cord syndrome, which is really rough. I'm also a chronic illness advocate. I'm a CHAMP inaugural board member, have gone to Headache on the Hill numerous times, and just really love our chronic communities. So we're going to get right in here and understand what gaslighting is. Gaslighting is intentionally verbally manipulating someone so they question their beliefs, judgment, reality, memories, or sanity. And there's lots of different techniques of gaslighting. One technique is countering, and examples of countering is you never remember things accurately. You have a bad memory. Withholding is another technique. I don't know what you're talking about. Trivializing, you're overreacting. Denial, I never said that. Blocking, diverting, why are you so defensive? And so with that, there's medical gaslighting. And this has an abundance of different things that may have occurred to you. I know many have occurred to me, and I actually don't know anyone in the chronic illness community that gaslighting hasn't occurred to, sadly enough. So we're going to go through some examples and just kind of take note which ones you've experienced or which ones maybe friends or family members have experienced. So examples, being told your increasing concerning symptoms are just anxiety. Those symptoms are just a panic attack. All your labs came back fine, so you are fine. We don't need to do any additional tests. I'm sure your other doctor didn't mean that. Maybe you misheard. You're over-exaggerating. No one can have that many symptoms and still talk or smile. Some more examples. You just need to exercise more or lose weight. This procedure typically isn't painful, so you shouldn't have had that response. I barely did anything. It's all in your head. Here's a referral to a psychiatrist or a therapist. What did you do? Google your symptoms? I went to medical school and know more than the internet. I have never had a patient with that diagnosis, so you don't have that. And so there's a lot of signs that when you've dealt with gaslighting, you might feel some of these things. You might feel confused. You might get defensive. You might doubt yourself, question your reality and your memory, have trouble making choices, decisions, feel you have to prove yourself, and sometimes even make excuses for the person who's gaslighting you. And of course, medical trauma and gaslighting absolutely go hand in hand. Medical trauma is defined as a set of psychological and physiological responses to pain, injury, serious illness, medical procedures, and frightening treatment experiences. Little side note is if you visit this website on here, there's a great sheet for fact sheet for survivors that discusses medical trauma in relation to PTSD. So here are some signs you have absolutely experienced medical trauma or gaslighting. You feel you must plan extensively for each medical appointment. You do not feel comfortable or safe enough to go to a doctor appointment alone. Before a medical appointment, you mentally go through all the worst things that the doctor, nurse, or other staff may say or do, and you think a lot about how you should respond. You can shut down in medical appointments or become emotionally numb or mentally exhausted after every appointment. You might question yourself and the validity of your pain. You might wonder if your symptoms are really bad enough to get treatment. You might even have thoughts such as, maybe that doctor is right. Maybe it is all in my head and I'm over exaggerating. You might even avoid social media, TV, films, books, and environments or conversations that remind you of your past medical experiences. And you might feel physically ill and have increased anxiety before medical appointments or even after. And so a lot of times you might hear people then say, well, it's time to switch medical doctors. I can't believe you've dealt with all that. But there's lots of reasons why people may not be able to switch medical doctors. And so I think it's important and worthwhile for us to discuss that as well. So one is institutional racism in the medical system. Or you live in a rural area and there's only one specialist in your area and you already have to travel to that specialist. Maybe it's the cost and you can't afford to pay out of pocket. Maybe insurance restricts who your doctors are, who you see. Maybe you can't physically travel far. And maybe you've already waited 6 months, a year to see this doctor and you really just need to try to move forward with treatment. So there's lots of reasons why you might still end up seeing a doctor who you feel has been medically gaslighting you. And this is a great place to start. So if you do have a spinal CSF leak or you suspect you do, reach out to credible organizations such as the Spinal CSF Leak Foundation. They have resources from amazing physicians who properly diagnose and treat spinal CSF leak, so you can be able to not feel alone, hear patient stories, and get some guidance. And so again, a lot of times, what can we do if we're having these symptoms or are already diagnosed? We start often at our primary care physician. And if that doctor is not supportive, it's maybe best to not see that doctor again if you can. You will know if it's the best decision for you to not see that doctor again if you're continually experiencing the symptoms of being medically gaslit that we discussed earlier. And you may have to, unfortunately, see many doctors before you find the right one who will listen. Some extra things that you can do is to keep a record, written or voice memos, of what was discussed in doctor's appointments, include dates and times. And you can talk about your experience of medical gaslighting with someone you trust, such as a therapist, a family member, a friend, because it's really important for you to be able to make room and process for everything you've experienced. One thing that I've heard that can help is that when a doctor refuses to run a test, you can ask for this to be noted in your chart. And many people say when they make that request, the doctor ends up doing the test that is needed. So that's something else to think about. And one thing we're going to be practicing in a little bit is practicing out loud assertive replies in front of a mirror with your therapist and or family or friends, so that you feel a little more prepared when you go into doctor's appointments. For some people, after they receive their spinal CSF leak diagnosis, they might write a letter to their past doctor who is unhelpful to let them know of their diagnosis. They do this in hopes that the next time that doctor has someone with similar symptoms, they'll consider a spinal CSF leak diagnosis and refer that patient to the proper specialist. Sometimes people do what I call as a no-send letter, where they will write letters that are unedited to a doctor, but they never send it. They just do it for their own processing and for their own empowerment. So that's absolutely another option. So let's talk about some assertive responses to gaslighting. Remember that assertive is different than aggressive. When we're having communications with medical doctors, assertive empowers you more than being aggressive, right? And so here's some that you can practice and reword to better fit you and your situation. So I realize you disagree with me, and this is how I see it. I see that your perspective is different from mine, but I'm not imagining things. Name calling is hurtful to me. I'm finding it hard to hear you when you talk like that. I hear that your intention was to make a joke and the impact was hurtful. My feelings are my feelings. This is how I feel. This is my experience, and these are my emotions. It sounds like you feel very strongly about that, and my emotions are valid too. I feel like I'm not being heard, and I want some space. I understand that this is what's best for me, or I know what's best for me. This is what I want and what I need right now. I'm making this decision for myself. And as we go through these, note that some of these might apply more to family members, coworkers, bosses who medically gaslight you. So again, you're going to want to shift these as you see fit. So I changed my mind. I'm not responding to that. I want to figure things out for myself. It's hard for me to stay engaged in this conversation. I've already said no several times. I'm finding it difficult to keep discussing this. I have heard your point of view many times now, and I still don't agree with it. I'd like to take a break from this conversation. I don't like how much energy I'm putting into proving my perspective, and it would mean a lot to me if you gave me the benefit of the doubt. This is a good one I think a lot of people like and is kind of like their default. I get that you're mad and I'm angry too. So what I'd like you to do right now, as we kind of think about all that we just talked about, is get out a piece of paper or your phone, and we're going to just take some time to write. And before we do that, I just want us to take some slow, deep breaths together. Try to relax your jaw, soften your shoulders. Let's just really be in this moment together. We're going to honor the experiences that you've gone through. And we're going to take about 5 minutes. And I'd like you to write about one time you experienced medical gaslighting. Write this just for yourself. This is only for you. And some ideas, you might end up putting the approximate date, or was this a medical professional or family member that you experienced medical gaslighting with? What was the context? What did they say? What did you say? How did you feel during and after? What do you wish you said? And so again, you'll have about 5 minutes. No worries if you don't finish. You can come back to this on your own time. And if you don't wish to participate, that's okay. Take this time for yourself. You might end up writing why you don't want to participate, what's holding you back from telling your story. Or you can just doodle, draw, write, deep breathe, just be. This time is for you. Okay, so go ahead and stop where you're at. Again, know you can come back to this. And let's just give us some space. It can often feel like a lot when we revisit some of these things. And let's lean into some self-compassion. Just acknowledging and recognizing that we've had to deal with very difficult experiences, right? And if self-compassion is difficult in this moment, that's okay. Acknowledge that every single person watching this has a personal story or knows someone who has experienced gaslighting. And so go ahead and extend loving kindness to them. And if that's difficult right now, just focus on slowing your breathing. Sitting with these emotions can absolutely be very difficult, but it's important to our healing. Every bit counts, even if it's for 5 seconds of leaning in. So just some deep breaths again, right? And so what now with this? If you are comfortable, you can share your experience. Let the listener know that you don't want them to try to fix anything or give suggestions. You just need someone to hear you. And so you may decide to talk to a friend, a family member, a therapist, to be able to process the experience that you just wrote down. It's really important to remember Your voice is important and your experience absolutely matters. And remember, our community matters. Know that you are not alone. Thank you so much for having me today, and I hope this presentation has given you some things to think about, and know that you can reach out to me with any questions that you may have. Thank you.